In this chapter on Save Kidney video book, today we will discuss about major kidney diseases and how we categorize each kidney problems. So any kidney problem where we give medicines to cure it or give only medicine, we call it as medical kidney diseases. When we need to do operation, we call it as surgical causes. Among the medical causes of renal disease, acute kidney failure, chronic kidney disease, urinary tract infection, nephrotic syndrome are the major categories which fall under the medical causes of major kidney disease. Stone disease is the most common surgical, which also comes under medical when it is a small sized. Prostate related problem where we give medicine at early stage, but later on we may have to remove the prostate gland. Congenital developmental defects, malformation may need surgical corrections, and cancer. So this is the broad category under which we classify the medical major kidney diseases. But for ordinary person, all these medical terminologies or the specialists are all a big elephant which has to be described with eye closed. So who is a gastroenterologist, rheumatologist, endocrinologist, dermatologist, we medical people know, but for general public this is very difficult to know to whom to go. So medical related problem is dealt by the nephrologist, who is a physician, and they do not do any surgeries. Urologists are the doctors who do operations, who do cystoscopy or laparoscopy and deal with stone diseases, lithotripsy. All these are urologists who are surgeons. So doctors who do not use knife and surgery are called nephrologists. Those who deal with kidney problem that require invasive procedure, they are called urologist. And trust me, I am a nephrologist. You can party with a nephrologist, hug a nephrologist, discuss with a nephrologist, or see various nephrologists. But when it is a kidney failure, major kidney diseases, you have to know that the kidney are not able to excrete the waste products, they are not able to maintain their electrolyte balance, not able to maintain their blood pH, and all these are not a single time visit. This becomes a lifelong, everyday visiting a nephrologist, whereas urologist you only go when there is a need for a surgical relief. And all this inability of the kidney to maintain the body internal milieu is called as kidney failure. And what happens in kidney failure? There is a rise in level of waste products as measured in terms of urea and creatinine, which confirms that a person has kidney failure. So now kidney failure are two types. One is acute kidney failure. With proper medical treatment and at time dialysis, kidney function returns to normal in almost most of the cases if it is treated properly. And sudden loss of kidney function is termed as acute kidney injury, where the urine volume reduces, patient is not able to pass urine. Most important causes are the diarrhea, vomiting, malaria, hypotension, sepsis, infections. Certain medicines can also cause this problem. Most likely are the painkillers and ACE inhibitors. Whereas chronic kidney disease is an irreversible condition and it is progressive. That means it doesn't reverse, it keeps worsening over time, with loss of kidney function over several months to years. This is called CKD. In CKD, kidney function reduces slowly and continuously after a long period of time. It reduces to a stage where kidney stops working almost completely. This advanced and life-threatening stage of disease is called end-stage renal disease, ESRD or ESKD. So kidney failure, remember, acute renal failure, sudden loss of kidney function, injury can be toxins, and this function recovers. Chronic kidney disease CKD is long and usually slow process where kidney lose their ability to function. End stage renal disease when kidneys completely fail and there is a permanent shutdown and person cannot live without dialysis or transplantation. So when you see a normal kidney, you see size is normal, smooth, whereas when it starts shrinking, the granular surface happens and kidney looks smaller, urine output also reduces. Common signs that occur when there is a kidney failure include early stage increased thirst and urine production, decreased appetite, weight loss, foul or uremic breath, bad breath, vomiting, sometimes diarrhea, sore throat, weakness, lack of energy. So chronic kidney disease is a silent disease, often goes unnoticed. In early stages of CKD, signs or symptoms are very few. Weakness, nausea, vomiting, swelling of the body, high blood pressure, etc. are common. Two most important causes of CKD are diabetes and hypertension. So we have to be aware of this problem. Stages of kidney failure. Based on how much kidney filters are damaged and how much they function, CKD is staged as early stage where kidney loss is just 20 to 30% and it doesn't affect much of our body. In the next stage, it is middle stage where the loss of function is more than 30% up to 60%. End stage is when the function is less than 20%. So this is done by calculating what is called GFR, that means glomerular filtration rate, which indicates how many filters are still alive and how much filtration happens in the body. So here we see in stage 1 GFR is more than 90, it's early stage. Stage 2 GFR reduces between 89 to 60, moderate it comes to around 59 to 30, and severe stage we see 75% damage, kidney function reduces below 30 but above 15, and if the function is less than 15%, we say it is end stage renal disease. So depending on the stage of the kidney disease, treatment also varies. In early stages we emphasize on the diet, exercise and to reduce the risk factor. Moderate stages we become more aggressive in control of water, diet, we restrict lot of diet and also strictly control the blood pressure. Severe stages we alter their medicines, which when given in early stages, severe stage we need to reduce their sugar medicine, and this has to be handled by the nephrologist. And late stages patient goes on CAPD or hemodialysis. So what is GFR? GFR is glomerular filtration rate, as I said, is calculation to find out how much kidney is damaged or how much is working. Normal GFR in Western standard is 100 to 120 ml per minute, but for Indians it is almost 60 to 80, we call it as normal. When kidney fails, GFR goes down below 20. This is called ESRD. So the commonest method we use is by a formula or by isotope scan. There are many kidney diseases where kidney doesn't fail, it is just that the filters or the tubes are damaged and they have ability to recover. So in many cases the kidney filters undergo continuous damage but fight back by regenerating and repairing itself without failing. This is called kidney disease and not kidney failure. So you have to be differentiating between failure and disease. So nephrotic syndrome is one such where commonly seen in children, also in adult, where high amount of protein leaks in the urine. Nephritis is inflammation in the kidney. When RBCs or WBC comes in the urine, it is nephritis. In urinary infection, there is a bacteria or fungus or TB affecting the urinary tract. So causes of kidney disease, it can be because of stone, genetic, because of family history, diabetes, infection related, drug related, poisons, allergies, occupational and toxins of the environment, pollution, pesticides induce kidney disease. All above or name given which is a trigger factor which can lead to chronic kidney disease if ignored, end stage kidney disease. So commonly we see diabetes affect 40% of the people. Next is high BP, 27% of people. Interstitial nephritis, glomerulonephritis is 14%. Remaining others like stone disease, genetic disease, infection, drugs, all comes under 18% category. So this overview